Good afternoon. Welcome to another edition of Ask Me Anything, at the program where our esteemed clinicians come together to answer your questions about a specific topic. Bienvenidos una vez más a nuestro programa donde entre amigos vamos a responder sus preguntas sobre un tema específico. Y el tema de hoy es la vacuna del COVID. Today's theme is all about the COVID-19 vaccine, and there's lots of questions that have come in. Please send your questions via the chat tool, whether you're watching on YouTube or Facebook, and we will be very happy to answer them. Por favor, sometan sus preguntas en el chat y le vamos a responder. Today, we have two great clinicians with us. We are so happy to have the time with them. Hoy tenemos dos invitados muy especiales. El primer invitado es el doctor Ravi Ajmera. Dr. Ravi Ajmera, he is the medical director at our Greenway Health Center, and Dr. Lois Wessel, one of our long-term clinicians that has been serving the community for many, many years. Bienvenidos, welcome. It's lovely to see you. And here we are. We're going to talk about COVID-19. Are you ready? ¿Están listos?
I'm ready.
Okay. So the first question that is on our list here is, why should I get a vaccine if I cannot go back to normal life immediately? So I'll let you, Dr. Ajmera, respond as our infectious disease clinician.
Yeah, so, there are 3 vaccines currently available, and they all have very high efficacy rates. The goal of the vaccine is to get the majority of the population vaccinated in hopefully a certain period of time where you can develop immunity amongst a variety of the population, much of the population. So then you have immunity amongst everyone, and so the disease has less spread. And also there's less spread of maybe mutated virus as well. So the CDC is still recommending that even though if you get the vaccine, you still have to take precautions such as wearing a mask or social distancing, because there is still some risk that the efficacy is not 100%, that you could maybe catch the infection still, although you may have no symptoms, but that could spread to other people. And until we get more and more people vaccinated, which is the ultimate goal, which is what's called herd immunity, if you will, then we can get back to a sense of normalcy, and hopefully that will be soon. But that's why it's important to get the vaccine. More and more people get the vaccine, and then more and more people are immune. The virus dies down, goes away, and you get back to a normal sort of life.
Voy a intentar decir lo que dijo el doctor en español. Él mencionó que hay 3 vacunas disponibles y que la meta es que una cantidad enorme de gente reciben las vacunas en un corto tiempo para que haya menos posibilidad que el virus se puede moverse dentro de la comunidad, pero tiene que mantener las mismas precauciones después de la vacuna, porque no sabemos si una persona que ha sido vacunado puede enfermarse sin síntomas con COVID-19 o COVID-19 y pasarlo a otra persona sin enfermarse, pero se lo puede pasar a otra persona. Entonces tenemos que mantener las mismas precauciones con la mascarilla, con la distancia social. Las vacunas no le protegen 100%, o sea, son buenísimos, pero hay una pequeña posibilidad que se puede enfermar. También hay partes del virus que están cambiando, que están mutando, o sea, está cambiando y no sabemos si las vacunas nos protegen en contra de todos los virus que hay de COVID-19. Pero en la manera en que más y más gente recibe la vacuna, vamos a tener una sociedad con más y más gente que no van a estar pasando la enfermedad o el virus a otras personas. Entonces, por eso es importante que todo el mundo reciba la vacuna y nos pueden regresar a un tiempo más o menos normal después de todo eso.
Mm-hmm. So, and another question that kind of ties up, since we're talking about efficacy rates, we are concerned about efficacy rates, but we also hear that other vaccines have way lower efficacy rates than the ones that we're getting with COVID-19. So what is that all about? We're getting superb protection. Correct, Dr. Ajmera?
That's right. So again, just to review, there are 3 vaccines that have been approved under the Emergency Authorization Act by the FDA. There's the Pfizer vaccine, a Moderna vaccine, which is one of the vaccines we've already started giving here at our CCI clinic, and then most recently, the Johnson & Johnson vaccine. People may have read or heard that the newer vaccine that just got approved, the Johnson & Johnson vaccine, may have quote unquote lesser efficacy rates. And although that may be true, so if you look at the Pfizer and the Moderna clinical trials, their efficacy rates were very good, over 90%, which is excellent. And if you look at the Johnson & Johnson vaccine, if you look at their efficacy rates, it was more in about the 70%. But again, if you read carefully, and I don't want to get into too much minutia about clinical trials, but the way the trials were done for the Moderna and the Pfizer versus the Johnson & Johnson was not the same. So it's not apples to apples, if you will. It's kind of apples and to oranges, I guess. They weren't the same. They weren't testing the same endpoint. For example, if you look at the Moderna vaccine, what they were looking at is just how many people 14 to 28 days later after they got the second shot had symptoms of COVID, whether that be even a runny nose or a cough. Johnson & Johnson looked at something a little more specific and looked at how many people had moderate to severe COVID and then very severe COVID, where they had really bad respiratory symptoms and cough. So it was kind of a different endpoint. The other thing that has to be brought into account is the Johnson & Johnson vaccine was also studied in other parts of the world, including South Africa, for example. So when this study was being done, there were already some variant or mutated viruses that were out there. So it's also hard to explain if the lower efficacy may be because of those other mutated viruses that it may not work as well against. But again, my bottom line is this. All 3 vaccines are good. They're all efficacious. You should get one of them. They will protect you going forward. And if everyone can get vaccinated, again, we can get back to some sort of normal life.
Luisa, buena suerte.
Ok, voy a ver. Lo que estaba diciendo el doctor es que en este momento hay 3 vacunas que han sido aprobadas a través de una autorización especial de emergencia en los Estados Unidos. Y está la vacuna de Pfizer, la vacuna de Moderna, y está lo más reciente que está fabricado por la compañía Johnson & Johnson. Hay gente que están preocupados que la vacuna de Johnson & Johnson, que también nos llamamos JJ, es menos eficaz porque en los estudios solamente protegió a un 70%, mientras el Pfizer y Moderna, esto tenía una eficacia de 90%. Pero es importante, como dijo el doctor, no estamos comparando manzana a manzana, es más bien comparando una manzana a una naranja, porque los programas que usaron para evaluar las vacunas fueron diferentes. Y en las vacunas de Pfizer y Moderna, ellos buscaron el número de personas que tenían síntomas de COVID, o sea, que tenían mocos o tenían tos, y JJ buscaron la cantidad de gente que se enfermaran con COVID severa, o sea, que realmente se enfermaran gravemente con COVID. La otra cosa con la vacuna de JJ es que hicieron sus estudios en otras partes del mundo, incluyendo en Sudáfrica. Y en Sudáfrica hay un tipo del virus de COVID-19 que es más o menos nuevo, que ellos estudiaron. Y este virus que se ha cambiado un poquito no fue estudiado por Moderna y Pfizer, o sea, no es parte de su estudio. Entonces, eso es donde hablamos de que las comparaciones en cuanto a sus estudios son diferentes. Lo que dijo el doctor, y eso es lo más importante, es que las 3 vacunas son buenísimas. Cada una es buena, todos son buenos en contra del COVID, y lo más importante es que cada quien recibe vacuna. No importa la marca de vacuna, pero que cada quien recibe una vacuna, porque eso nos va a ayudar a regresar a la normalidad, a la vida cotidiana que conocíamos antes de COVID. Y la ciencia en cuanto a los números de qué porcentaje es, realmente eso no tiene mucho que ver con el poder que tienen las vacunas.
Muy bien. Entonces, ya escucharon, amigos, cualquiera de las 3 vacunas les sirve. Por favor, no pierdan tiempo y busquen una vacuna. Vamos a hablar de los mitos. Hay muchos mitos en la calle sobre esta vacuna. Entonces, el primer mito que aparece en nuestra pantalla es, a mí ya me dio COVID, o sea que tengo inmunidad. No necesito la vacuna. ¿Qué piensas tú, Luisa?
Okay. Mira, realmente hay mucho de COVID que no sabemos todavía. Aunque uno se enfermó con COVID, eso no quiere decir que no se puede enfermar de nuevo. Como no sabemos, no hemos tenido COVID por mucho tiempo, muchos años, para estudiar a través de los años cómo va a desarrollar el COVID. Ya sabemos que en un invierno se puede enfermar con influenza y el otro invierno también se puede enfermar de influenza. Es probable que más adelante COVID va a ser como, o la vacuna de COVID va a ser como la vacuna de influenza, que cada año hay que recibir un refuerzo, como decimos en inglés, un booster. En este momento no sabemos si los anticuerpos que uno desarrolla en contra de COVID dura por mucho tiempo. Entonces, aunque ha tenido COVID, se ha enfermado con COVID, se puede recibir la vacuna después. Si estaba grave en el hospital y le dieran plasma o le dieron una cosa que se llama anticuerpos monoclonal, tiene que esperar un tiempo, o sea, 3 meses. Pero si uno estuvo en la casa con COVID, ya que esté mejor, se puede recibir la vacuna. So Jose Luis was asking about some of the myths, and one of the myths may be that if you've had COVID, maybe you don't need to get the vaccine. And I said that is indeed a myth, because there's a lot about COVID that we just don't know. And just like with flu, you can get the flu and you could get it another year, and every year you should get the flu shot to protect yourself against the strands of flu that we know about that exist. That may end up happening with COVID. We don't know how long your protective antibodies are that would keep you healthy after having had COVID. They could wane. So it is advised that even if you had COVID, you go ahead and get the vaccine. And as soon as you're feeling better, 10, 14 days after you've had COVID, you can get the vaccine, with the exception of the fact if you were hospitalized and you got either something called convalescent plasma or something else called monoclonal antibodies, then you do have to wait for 3 months until you can get the vaccine. But the majority of people who have had COVID are people who were sick and they didn't feel good, but they were at home and they got better. And those folks can certainly go ahead and get the vaccine 10 to 14 days after having been sick with COVID to continue to protect them long term.
Great. That was wonderful. Do you have any thoughts about that, Dr. Ajmera?
No, I 100% agree. That's very well said.
Wonderful. Now, another topic of conversations that many people have is the whole idea of the side effects, right? Many people are reacting very differently from the vaccine, and some have from no side effect to some real complications. So people are afraid about the side effects. What can we tell them about that? So to persuade them to take the vaccine.
So the Moderna vaccine, again, the one that we've been giving here at the CCI clinic, has minimal side effects. And I've been giving it for months, and I've really seen no reactions at all of any significance. There have been reports of patients who've received the Moderna vaccine, specifically what I'm talking about, who've had an allergic reaction. Some of them may be somewhat severe, what's called anaphylaxis, where they get itching of their skin, maybe their throat swells up, and that was treated right away with medication. Those patients who had that reaction tended to have a history of having severe allergies to other things, or having a history of allergic reactions to other products in the past. So they have already some predisposition to that. But again, it's very, very rare. I have not seen it in my time giving the vaccine here. Now, for precautionary measures, what we do at our clinic here at CCI is when you get the vaccine, the Moderna vaccine specifically, we do go through a checklist of various questions to see if you have any history of allergic reactions to medications or other products. If you do, you're observed after the vaccine, whether you have allergies or not, you're observed in our waiting room for 15 to 30 minutes. If you don't have any history of any severe reactions, we watch you for 15 minutes, and then you can go home. If you have some history of an allergic reaction or anaphylaxis to some sort of medication or other product, then we'll watch you a little longer for 30 minutes. Most of the time, if you read about the reactions to the vaccine, it's been within a very short time frame, within that 15 to 30 minute window. At the same time, at our clinic, we have medicines on hand. If in the very, very, very rare event you were to have a reaction, we have medicines on hand to treat it right away. But again, I want to make note that this is a very rare occurrence. I've not seen it, and it's very rarely reported. It should not deter you from getting the vaccine. And if I may just talk quickly about the new vaccine, the Johnson & Johnson vaccine that has come out, that even has less side effects. There's not, at least so far, at least from the clinical trials, there was not much seen in terms of an allergic reaction to the vaccine. The most common reactions to the Johnson & Johnson vaccine was pain at the site of the injection, maybe some fatigue the next day. And then I'm sorry, to go back to Moderna as well, there are other side effects which are minimal, which you might have the next day, such as pain where the injection was at in the arm. You may have a little fatigue. You may have a little mild fever. You might have what's kind of called, quote unquote, mild COVID symptoms. It goes away within a day or two. I had it myself. You can take some Tylenol for it. It generally is not a problem. So again, all these side effects you read about should not be a deterrent in getting the vaccine.
Voy a ver si puedo decir eso. Los efectos colaterales no debe ser una cosa que le da miedo en cuanto a no recibir la vacuna. El doctor habló de que en los estudios de Moderna había unos cuantos efectos colaterales, pero fueron mínimos. Y habló mucho del hecho de que ha habido gente, pero una cantidad muy pequeña, que tuvieron una reacción alérgica severa. Eso es lo que nosotros llamamos anafilaxia, o sea, picazón del piel, que una sensación de que la garganta está muy grande y no puede tragar. Pero nosotros, para prevenir eso, y vuelvo a decir que es un efecto súper raro, y una paréntesis que en este mes yo creo que he dado tal vez unos 500 vacunas trabajando como voluntaria en Montgomery y PG County, y no hemos tenido ni uno de estos en los sitios. Pero sin embargo, parte del proceso de recibir la vacuna es primero hacer unas preguntas, un cuestionario para asegurar que no tiene una historia de reacciones alérgicas a vacunas o a medicina. Y la otra cosa es hacer a todo el mundo una observación de 15 minutos para saber cómo se siente. Pero si es una persona que tiene una historia de haber recibido una reacción severa de una vacuna en su pasado, nosotros le podemos observar por como media hora. También tenemos medicina en caso, o sea, en CCI, por si acaso tiene una reacción, le podemos dar una medicina inmediata. El doctor mencionó que la nueva medicina de J&J tiene menos efectos colaterales, menos reacciones alérgicas. Lo más que había fue dolor en el sitio de la inyección, un poco de cansancio. Sin embargo, como todo esto es una reacción fuerte, es bien raro, bien es cierto que hay mucha gente, y el doctor dijo que eso le pasó, no me pasó a mí, pero sí me pasó a mi esposo, tuvieron un dolor en el sitio de la vacuna el día siguiente, un poco de cansancio, tal vez un poco de fiebre, o sea, como síntomas de COVID, pero bien suave. Se puede tomar Tylenol, generalmente estos síntomas no duran más de un día, y lo más importante es que eso quiere decir que su sistema está trabajando, desarrollando sus anticuerpos en contra de COVID. And I'm just going to add in English, one thing that Dr. Ravi didn't say was that or that I added is that I've been vaccinating as a volunteer in Montgomery and Prince George's County, and at the site, I've probably given 500 in the last month, but at a site I was at the other day, we gave about 1,500, all of us together, and not one person has had an allergic reaction. But again, we do have medicine at CCI if anybody did have an allergic reaction.
O sea que no hay que tenerle miedo a los side effects, a los efectos colaterales. Vengan a vacunarse una vez más, la primera oportunidad que tengan. Otra pregunta que acaba de entrar es, me pongo la vacuna, ¿cuánto me dura la protección?
Mira, no sabemos todavía cuánto le dura la protección. Bien es cierto, con la vacuna de Moderna, lo que estamos dando en CCI, hay 2 vacunas con unas 4 semanas, o sea, un mes entre las 2 vacunas. No sabemos todavía cuánto se dura la vacuna. Lo que sí sabemos es que más adelante en el futuro, como que mencioné antes, posiblemente va a ser como la vacuna en contra del flu. Y cada año va a ser una receta un poco diferente para cubrir los cambios del virus, porque los virus siempre están cambiando. The question was, how long will the vaccine last? And I said, we still don't know all the details about how it will last, because this is also new. We do know that for the Moderna vaccine, what we're giving at CCI, they're 2 shots, 28 days apart, and that probably in the future it will be like the flu shot, where every year we may need a booster to cover us against new strands and mutations that have been developing. But we don't know initially with this first vaccine how long we will have protection, and that's something that a lot of people are doing research on. I don't know if you have another opinion about that.
No, I agree. You know, we don't know how long it'll last. You know, these are ongoing studies observationally going forward, how long the protection will be. And again, like you said, I agree. There might end up needing booster doses, just like we do for the flu shot every year. So it's very unclear at this point.
And so just like we do for the flu shot, who should be getting the COVID-19 vaccine?
Yeah, that's a great question. In the end, you know, everyone hopefully will get vaccinated, at least ages 18 and up. You know, that's the long-term goal eventually. Right now, the priority has been, you know, the CDC has had different phases of high priority groups or prioritizing populations that are higher risk and going down that line. So originally the first higher priority group were patients who lived in nursing homes or long-term care facilities, healthcare workers, or who worked in those facilities. And then that changed over to patients who were greater than age 75. And now we're kind of at the stage where we're at age greater than 65 and above, that we are prioritizing for that population to get vaccinated. Because of, again, the reason being is that the elderly population, those 65, 70 and above, can be at higher risk of having more severe symptoms if they were to catch COVID, meaning respiratory symptoms, etc. So it's kind of in a phased format. And again, right now, that's where we are now at this age group. But that hopes to continue to get expanded as we have more vaccine rollout distribution, and we can expand it to more and more different groups of population and more age groups, etc.
En este momento, todo el mundo debe recibir la vacuna cuando pueden. Hasta ahora solamente estamos dando del 18 años y para arriba. Al principio, cuando las vacunas salieron, las prioridades fueran la gente que vivían en lugares de ancianos, porque son ellos que están a alto riesgo por tener más síntomas respiratorios hasta la muerte. Y también en la primera etapa fueron los trabajadores de salud, la gente que están trabajando en las clínicas, en los hospitales. Después en Maryland se puso la siguiente grupo, como la gente que tenía 75 años para arriba, ahora está a 65 y para arriba. Tengo entendido también que por fin están dejando entrar en este grupo ahora los maestros con la esperanza que van a regresar a las escuelas pronto. Pero mientras haya más vacunas disponibles, se van a bajar la edad y cada quien que es más viejo de 18 años va a poder recibir la vacuna y va a ser en etapas que vamos a tener disponibles las vacunas.
Muy bien. And so, and so, Dr. Ajmera, you said that we are vaccinating our health centers. What is the easiest way for any of our patients to come and get vaccinated?
So we are vaccinating at our multiple CCI sites throughout in Prince George's County and Montgomery County. The easiest way, I think, is for a patient to call at any of those clinics that they go to, or whichever clinic they prefer, and ask that they would like to enroll in our COVID clinic vaccine or enroll in getting a vaccine for the COVID vaccine. And you'll be placed hopefully on a list that we can then get you a COVID vaccine hopefully soon. Now, again, as I was saying before, just like the federal government and nationally and statewide, it's by phases. We are still doing it by priority groups. So we're still putting we're still giving it to the priority groups of people age 65 and above. But again, we hope that we will increase the distribution to more age groups and more population as we get more vaccine and as it's been rolled out and distributed more.
Mm-hmm. And let me just add one thing to that, and then we'll say it in Spanish, but I don't know if you, Dr. Ajmera, if you followed this, but I heard today on the radio that I'm pretty sure it was Pfizer, but they're doing clinical trials in 14 and up now.
I did read that, yeah, but yeah. I don't know much about it. But I did read that.
La pregunta fue, ¿cómo se hace para conseguir una cita para la vacuna en CCI? Si tenemos vacunas, estamos priorizando la gente que tiene 65 años para arriba, que es parte de las etapas que manda el gobierno. Se puede llamar a su centro de CCI para ponerse en la lista. Se puede decir que quiere la vacuna de COVID, vamos a tomar su información y le vamos a llamar cuando tenemos cita disponible. Y vamos a estar incrementando las citas cuando tengamos más vacunas disponibles y también cuando se expande a gente menos de 65 años. En este momento la prioridad son la gente de 65 años para arriba. Vuelvo a decir que ahora solo han sido aprobados por gente de 18 años para arriba, pero yo escuché hoy en la radio que están haciendo estudios para los jóvenes de 14 años para arriba, que se supone que ya para septiembre va a estar disponible para los adolescentes. Pero en este momento se puede llamar a su clínica, a CCI, para ponerse en la lista para recibir la vacuna.
If I could add one more thing, I'm sorry. Yes. If you actually come into the clinic and you see your provider that day in person, also please mention to your provider, I'm interested in getting the vaccine. Please put me on the list. And you know, I was seeing patients today. I had multiple patients who were interested. I put them on the list. Hopefully they'll get called and get an appointment at some point and get the vaccine. So if you come into clinic as well, don't hesitate to ask and get put on the list.
Sí, también si usted tiene una cita con su proveedor de salud de CCI y le interesa estar en la lista, se le puede decir a su doctor, su enfermera, cuando estén en la clínica, que quiere estar en la lista y ojalá que pronto tengamos una cita para que usted pueda venir para la vacuna.
Pues amigos y amigas, ya lo escucharon acá. CCI está dispuesto a darle la vacuna. Lo que necesitamos es saber que la quieren y que usted sea paciente nuestro. Aquí va el número abajito. Llame ese número para pedir una cita y para que nosotros podamos vacunarlo en contra del COVID. Well, you heard it here. We are ready to vaccinate you. We're just waiting for the right age groups to be opened up, and we cannot wait to see you. Once again, thank you, Dr. Ajmera. Thank you, Dr. Wessel, for spending this half an hour with us and our friends out in the communities answering their questions about COVID-19 and the vaccine. Until next time, nos vemos la próxima vez. Stay tuned. Thank you again.
Pleasure. Thank you. Gracias.
Bye-bye. Thank you. Bye-bye.